You've just seen how stem cells from a newborn baby's umbilical cord can be used to treat a child and even their blood relatives. Now take a look at how adult stem cells taken from body fat can be transformed into a variety of treatments, which include cosmetic and breast reconstructive surgery.
In the plastic and reconstructive area, we know that worldwide there have been now hundreds of men and women operated on where they have transferred stem and regenerative cells in fat for breast reconstruction, for injuries of radiation to the breast or the chest wall or anywhere on the body.
Fat-derived stem and regenerative cells provide new opportunities for reconstructive and cosmetic procedures.
Many other patients who never would have dreamed of an implant but would imagine themselves using their own tissue, it suddenly opens up a whole new option for those patients.
Turning fat into a thing of beauty used to just be wishful thinking. Now it's becoming reality, says board-certified plastic surgeon Stephen Cohen.
A lot of patients come in and, jokingly go, "Doctor, can't you take the fat from here and move it here?" And it's like, in the past, ha ha ha, no, we can't. In the future, absolutely.
The future is now, in part because of researchers at Satori, a San Diego-based company that has developed a new way to automate the extraction of adult stem and regenerative cells from a patient's fat. Physicians can then take those cells and put them directly back into a patient for a variety of treatments. Dr. Mark Hedrick, president of Satori, explains how the cells are separated from the fat.
The cells are buried inside of what we call the matrix, which is the scaffolding of the tissue. And to pull the cells out, you have to use chemical scissors to break up the matrix. And then you have to pull the cells out carefully so that they still work, and then get rid of all the other stuff that you don't want.
A half a cup of fat, he says, yields millions more stem and regenerative cells than traditional adult stem cell sources, and it's less painful to harvest. In the last 4 years, over 500 Satori patients in other countries have been treated for heart disease, breast reconstruction, male incontinence, and other conditions.
I think in the next 5 years, you'll see this technology not only being considered commonplace and accepted treatment for a variety of medical conditions, but you'll see that it'll expand to more and more different kinds of conditions.
Procedures using fat-derived stem and regenerative cells are being done in Europe, Japan, and Asia. Technology to enable the extraction of those cells is not approved by the FDA, but Satori is working with the FDA to get it approved, and for good reason, says Dr. Cohen.
There is no rejection phenomena that occurs.
That's especially important to breast cancer survivors.
They're being used extensively in women who have had lumpectomies and radiation to a breast, not only to recreate the shape of the breast, but also to provide these cells to reverse the radiation injuries that occur to the skin.
As a medical pioneer and avid painter, Dr. Cohen calls the emerging field of stem cell therapy a work of art, as each new stroke of science transforms our picture of healing. The transformation has begun in the United Kingdom. 2 women from Wales are part of a clinical trial for breast reconstruction with fat-derived stem cells. Their story aired on Wales BBC News.
Shirley Redden prepares herself for what could be a big step forward in her recovery from cancer. She had a tumour removed from her breast 2 years ago, but surgery damaged the tissue around it. She hopes breast reconstruction will help make her feel stronger.
Make me feel better in myself, and getting over the trauma of having the cancer and the treatment, which is wonderful anyhow. But when it's done, I would feel a woman again then.
Traditional breast reconstruction can be a long and complicated process, moving a muscle from the back. But this new technique is quicker, using just fat taken from around the stomach or thighs.
This can be performed as a day case rather than a 4-day stay. Patients get back to work much more quickly and get back to their normal activities more quickly. And in terms of scarring, it's absolutely minimal compared to a large scar, often on the back, which we have to do with other procedures.
The use of liposuction isn't new, but it's what's being done to the fat which is different here. Around half of the fat is placed into a special machine which can spin it to separate out the stem cells, those which stimulate new tissue to grow. The cells are then mixed back into the remaining fat and injected into the body to reconstruct the breast. Shirley's now ready for that second part of the procedure.
Yeah, I'm fine. A bit sober, I'm fine. Lovely.
And looking forward to getting this next bit over with.
Yes. I'm going home to have a nice cup of tea.
Those concentrated stem cells are now ready to be used and the reconstruction can begin. Having been processed, the same fat that just a few hours ago was taken out of Shirley's tummy is now being re-injected and reconstructing the breast. She's just the second person in Wales to have this done. The first was Samantha Wall-Jones, who had reconstruction just 3 weeks ago. She hopes others will now take courage from it.
I think it gives some amazing hope, and I hope maybe that they'll look at women like myself who've been through it and think, well, yes, it is a terrible disease and it's a terrible experience to go through, but there is now a possibility of almost being resumed to normal after having this procedure done.
Samantha and Shirley are just 2 of the 10 women chosen to have the treatment in the current trial. But if it's a success, this could become the way of helping more patients to rebuild their lives after breast cancer.
Another woman rebuilding her life through Cytori's clinical trial lives in Scotland. Irene McKenzie enjoys her daily walk, but for years, complications from breast cancer surgery kept her inside, scarred and in pain.
After my initial radiotherapy, I developed a lot of pain with scar tissue because following my partial mastectomy I had problems with infection and they had to keep draining the wound, so my breast was malformed. I wasn't happy with the way my breast was at all, and to me it just seemed to look worse and worse all the time, and it really affected me. With clothes, wearing clothes, it really was a problem. Getting things to fit me, and also my confidence, it totally destroyed my confidence as well.
Irene sought help and finally found it when her doctor asked if she'd participate in a European Cytori clinical trial.
A new trial came out for Cytori, which was using stem cell fat transfer, and she asked me if I would be part of that trial. I seemed to suit the criteria for it, so I said yes.
During the clinical trial, Irene had her breast reshaped with her own fat-derived stem and regenerative cells, a technique plastic surgeon Stephen Cohen says may improve healing and speed recovery.
What happens, though, is the fat has to get a blood supply to survive, and because you're adding regenerative and stem cells with the fat that you're now injecting, you're enhancing and improving the ability to get a blood supply and for that graft to survive in full.
A couple of weeks after the procedure, Irene was back at work and walking pain-free. An enjoyable habit she hopes American breast cancer survivors will do as well with the help of stem cell therapy.
My advice to women would be to look at all options if they're looking for reconstruction, to look at all the different operations that are available and obviously which ones would suit them. The operation I had, the Cytori stem cell work, is a much less invasive operation than a lot of the other options available, and they should definitely consider it.
Coming up, cancer stem cells and the future of stem cell therapy for macular degeneration and cystic fibrosis.